Okay, welcome everybody. I'm so happy to be here today with Samantha Steele, who is a local here in Sacramento pelvic floor therapist. Samantha, why don't you tell us a little bit about what you do?
Sure thing. So first off, thank you, Catherine, for having me on. I'm so excited to talk to your group about pelvic floor issues. That's my passion as a physical therapist, is working with the pelvic floor and problems that can come on after pregnancy and postpartum. I actually work at Physical Edge in Davis, California, and I do see people both in person and via Zoom. So if you're in the area and you want to stop by, come on in. I actually went to UC Davis, so I'm familiar with the area, and I'm back in town after going to UC San Francisco for my doctorate and doing some advanced residency training in women's health. And I'm just a really passionate advocate of pelvic health. I really want people to take away from this presentation that peeing, pooping, and sex problems are common, but they're not normal, and there's something that you can do about it. So I really hate to hear women accept that this is just my fate after I have a baby and I have to deal with these things forever. I think there's a lot that can be done to help rehab your pelvic floor and get you back to doing what you love.
And so, so what would you say are like, well, I guess you just mentioned what the most common things that you hear about, but like what would you recommend like a woman to do to going forward? Like how she knows that it is a problem and it's not a normal thing. I guess that's it. Like what would be like the first signs? Like this isn't normal, or this is like something you can do something about.
Yeah, I think, well, in terms of the most common things that I hear as complaints, especially in the early postpartum period, is leaking. That's a really, really big one. So sometimes it can be leaking of urine or also stool, depending on some injuries that can occur during childbirth. Constipation and issues, pain with having bowel movements is another common concern. Also just feeling like you have to rush to the bathroom all the time. That can be something that comes from the pelvic floor, is that urgency to go. Worrying about things like jumping or running. I hear it all the time.
Sneezing.
Sneezing. Yep. I hear all the time. It's like, oh, well, I guess I just can't go on the trampoline anymore. And that's a pretty sure sign that you've got something going on in the pelvic floor. Pain is another huge concern that people come to me with. I know that it's common to have some scar tissue in the vaginal area after vaginal delivery, and then also C-section scars. So those things can definitely bring on pain in general, pain with sex, pain with exercise. And then a lot of times too, it's just, kind of the pains that come along with being a mom, back pain and SI pain, things that happen when you're trying to lift a million things and your baby and your car seat and all the gear that goes along with the little one. So that's another area that I work with my clients on.
Okay. And are there like things that you recommend that you could recommend for, because I know like these are things that I hear about like all the time, and I'm a marriage and family therapist, and these things pop up of just like concerns or frustrations about having these experiences. Like what would you recommend that they do?
That is a great question. Well, the easiest thing is to come in and see a pelvic floor therapist.
Yes, so specific, right?
Yeah. And I think it really depends on your problem, right? So I tend to think about the pelvic floor as being in one of two camps. We either have some weakness and some looseness that happens after delivery, or the muscles can go the opposite way and be in a state of spasm. They're too tight and they're painful. And so depending on what your issue is, I would recommend very different things.
Okay.
I would say that it's a safe bet. If you're having leaking, if you're having that sense of, I just don't feel like my muscles are supporting me very well, Kegels are a great option. I can definitely take you through a little virtual demo of how to do one if you'd like.
Yeah.
And then on the flip side of things, if you're having pain, I would recommend not doing Kegels. So that's kind of the two areas that I differentiate into.
So if there's like leaking or something like that, you probably need to do Kegels. But if there's like a tightness, or pain, I guess you said, then not to do the Kegels.
Exactly.
Okay.
Yeah.
Okay.
And it's kind of like, any other muscle in the body, right? I think of the
Mhm.
pelvic floor as just a set of muscles in a kind of a special area. They're muscles just like anywhere else. We can squeeze them, we can release them, we can use them how they're meant to be used. But we're not meant to be doing one thing all the time. So if the muscles are in a state of spasm and they're already spasmed, gripping them more isn't going to feel so good. And if you're weak and loose and the muscles aren't working that well in that respect, then strengthening could be the option. So it's kind of like you would rehab any other part of the body,
Right.
and it's just a little bit more specialized because we're also dealing with the urinary system, gastrointestinal system, and reproductive system.
Right. Like a lot of different things. What do you typically recommend for people to, like, if there is the tightness or the pain, like what is there besides, like Kegels for looseness? Is there an alternative for, like, to try at least? Or
Definitely. I think it's so common to me to hear postpartum that women are just a little nervous touching that part of their body, right? I mean, you just pushed out a baby and you're not quite sure how things are looking down there, and it can be really a vulnerable thing to touch your vagina after you give birth. And so that's my first recommendation is reacquaint yourself with this part of your body. I would say, just practice like light touch, even outside on the vulva. And if things feel painful, that's a sign that, okay, maybe things are in a state of tightness. Maybe we've got a little scar tissue that's feeling sensitive. And the great news about that is that postpartum scar tissue is something that can be really easily worked on and really easily improved.
Okay.
And typically the best thing is to desensitize the area. So you're just kind of working on it. Usually what I'll coach my new moms on is some specific perineal massage for scar tissue.
Okay.
I'm going to have you imagine that this is the vaginal opening here. This would be up kind of towards the pubic bone and down towards the rectum. And if you had a tear that's kind of down towards the rectum, as most of them are, I would say just insert your thumb, kind of hook it inside, and then you could kind of put your pointer finger on the outside, and you're just kind of rubbing the tissue between your fingers. And just a gentle massage like that over time can help to kind of break down that scar tissue and help things move a little bit better so you're less uncomfortable.
Yeah. Well, that's really good and helpful to know. Like they don't talk to you about this postpartum, when you go see your OBGYN or anything like that. Typically, I mean, I'm sure there are some out there that do, but it's not a typical thing. So this is so already so many things I didn't even realize, and it's so helpful. Yeah. So sex is a big issue too. Like I've talked to many people where it's like almost like I had someone once tell me they didn't even tell their partner that they had been cleared to have sex because they were so anxious and nervous about it postpartum. So what do you say about that?
It's
besides really, like talk to your partner about
definitely. Well, and I think that's that's where it's such a great thing to know somebody like you, right? So somebody who can help them overcome some of the anxiety if it truly is more of a fear-based problem. But I think the anxiety comes from a very real place because there is a lot of discomfort and there is a lot of healing that goes on postpartum. And I find that women go to that 6-week checkup and they get cleared for sex, but what does that mean really? And what I tell them that it means is that sex won't hurt you. So you're medically cleared. So maybe you're no longer bleeding, your cervix is fully closed, everything's looking good from a medical perspective. But that doesn't mean that your scar tissue is all the way healed. It doesn't mean that your muscles aren't in spasm. It doesn't mean that you are emotionally there yet, and that's okay. I found that some of the research that I've done on different surveys of women postpartum, about a quarter of women have sex by 6 weeks and 3/4 of women don't. So that's definitely not that's not the majority, right?
Yeah, right.
And one of the other studies that I found that said at 6 months postpartum, there were 92% of women who'd gotten back to sex, but a quarter of them were still having issues and pain with it. So, it's one of those things that I just hate to see women accept it as their new fate. I don't think it has to be forever. And there's lots of things that can be done pretty easily with that, but it's good to get some help if you're having that.
Right. Like not to, you know, I mean, I always like tell people like, you know, take things slow, like communicate with your partner about what feels good and what doesn't, because of course, like things change, like our bodies have been through, you know, having a baby, being pregnant, stuff like that. So it's like, make sure you're communicating and sharing and talking about those things that's important in your relationship. But then also if it's still not good, like, you know, talk to somebody. So, and I know a lot of them will go to their OBs and not get the answers they want, you know, because it'll be like, oh, but you're fine, go ahead. And so then it's like, okay, well, there are specialists that can help you if there is that pain. So this is helpful. Yeah.
And I think too, you know, I like to think about it as a different focus, right? I mean, the OB is worried about things that are going to kill you. And that's important, you know? You don't want to miss that OB appointment. It's good to make sure that there's nothing serious going on, but at the same time, they don't necessarily have the time to go through massage techniques and things to help you feel more comfortable. Different tools that you could be using. So that's kind of where rehab comes in, similar to how you would go to rehab if you had a knee problem.
Right. So this is interesting. And I'm sure it has something to do with the fact that I've posted things about pelvic floor therapy, because all of a sudden, you know how like Facebook will track and start sending you ads on things. And so now there's this tool, and I haven't clicked on it yet because I'm afraid I'll get more things, I guess. But it's a tool that's supposed to help with like doing Kegels or something like that. I don't know what it's called. I was going to write it down and then I never thought to ask.
There's a bunch of ones out there. I think the one that I've heard of most is the LV. It might be the one that it's like a little device that you insert.
It's like pink or something. All I know is it's like a pink thing.
I don't know the name of that one. There's a bunch of different kinds, but essentially they're all very similar in that they, you know, you insert it into the vagina and it tells you, okay, you're squeezing, you're releasing, and it kind of helps you learn if you're doing the right thing.
Oh, okay. But they're not necessary per se.
You know, I don't think so. They tend to be kind of pricey. I think they're a few $100, and I kind of think about it as, you know, you don't necessarily need an external device or a device that you insert to tell you how to contract one of your muscles if you already know how to do it. Those are great for people that really can't feel the right muscle, or they can't, you know, understand what they're doing, but most women can do a Kegel okay. And so I'd say just practice the squeezes, and you know, that might be enough to help you. You might not necessarily need one of those.
Okay.
I don't think that they're going to hurt. They're certainly not a bad thing. They're just another tool, but you know, they're not necessary in order for you to recover.
It's kind of like buying exercise equipment. Like you don't necessarily need exercise equipment, but it like sometimes you might find it beneficial if you're okay.
And there's some people out there who find it fun to have a little device and they got the app on their phone and that motivates them. And if that motivates you and you want to buy one, like go for it. It's not going to hurt you. I just don't think it's, you know, the end all be all.
Right. Okay. All right. Cool. That's good to know. Well, like anything else, like what do you feel like, like what do you see, like what are some other things that you would suggest, like how, like so most of the people like in this group, there are a lot locally, but we have some people that aren't, so it's like I could easily refer everybody to you and a couple other pelvic floor therapists, but how would you go about finding one? Like how you like
there's a couple databases online that are available. There's one through the American Physical Therapy Association, and it's like the Find a Physical Therapist locator. On that website, you can find your physical therapist and specify that you want it to be a women's health or a pelvic health specialist. There are a couple of other databases out there. I believe that there's one through Pelvic Rehab. That's another website, and you can search for different providers through that. And, you know, I think in general, it's the most personalized advice to go in and see somebody and get assessed. You know, it's kind of tough for people to really get in touch with their pelvic floors because it's an area that we're not really used to thinking about. So I always recommend, you know, coming in and seeing somebody, making sure that you're, you know, on the right track, you're able to squeeze and release really well. But aside from that, I think it's still worth trying to do some pelvic floor exercises. It's still worth trying to do some of the relaxation techniques before you come in and see somebody, because they're not going to hurt, right? It's a pretty low risk intervention to try those things. Yeah. And I think too, I have this little soapbox that I get onto with Kegels, right?
Okay, cool. Let's hear
So I'm
the
just going to
soapbox.
get on my soapbox right now.
I want to hear it.
So if I can have everyone listening take away one thing from this presentation is that it's not all about Kegels.
Right.
I think sometimes people hesitate to come into PT because they think, well, you know, they're just going to tell me I need to Kegel more and I already know how to do those. And first of all, I actually find that more people have difficulty relaxing from a Kegel than they do actually squeezing. And that's huge, right? If I were to treat your bicep, right? If your bicep had a strain or something, and I told you to just go like this all the time, you're just squeezing all day long, your arm wouldn't work very well. So walking around and Kegeling all day is not the answer. Your muscle has to relax sometimes too in order for it to function. And you know, it's so important to learn how to do both the squeeze part and the release part.
Okay.
And that's, I think, what is a missing component for a lot of advice that's out there on the internet.
Okay.
If you want, I can kind of coach you through how to feel that.
Yeah, I think I want to know because, I was just like, you're like, oh, knowing how to relax. I'm like, I feel like that's most moms. Like we're like you're on the go. You're always doing things. Like it's
so
like
true.
Like of course we're squeezing constantly.
Yeah.
Or like better at the squeezing than the relaxing. Because let's be honest, it's hard to make time for that. But yeah, like walk us through that. I'm excited.
Okay. All right. So for anyone listening here, I'm going to have you sit down in a chair. And if you're already sitting, just get nice and tall in your chair. And I want you to kind of feel that you've got equal weight on both sit bones and that you're kind of feeling the contact of your vagina and perineum on that chair. So when I talk about the perineum, that's an area of skin that's a really important site of a lot of different muscle attachments for the pelvic floor. And the perineum is the space of skin between the vagina and between the rectum. So it's kind of that area right in the middle of the pelvic floor. I want you to direct your attention towards that part of your body and just notice where it's kind of sitting in space. It might be feeling like it's kind of relaxed downwards, or you might feel like you're squeezing it up. And just kind of notice that. Next, what I'm going to have you do is perform a Kegel. So if you don't know how to do a Kegel, because we've been talking about it all the time, but sometimes people don't know what they are, it's basically a squeeze of the pelvic floor muscles. And it should feel like the muscles that you would squeeze if you were trying to stop the flow of urine or if you're trying to hold in gas. So the muscles around the vagina and around the rectum will squeeze at the same time. So you should feel kind of a front and back squeeze, and that's normal, and that's okay. So the next part of it is going to be the release part. So after you get done squeezing, I want you to notice if it feels like the muscles have a hard time letting go. You can practice that a couple times. What's that?
What would be a sign that we have a hard time letting go?
Yeah, sometimes what people will sense is that they'll just feel like they feel it squeeze and then they try to let it go and they're not really feeling a whole lot happen. Or they feel like it's still holding some, like there's some release, but it's still holding some tension.
Okay.
Another clear-cut sign that your muscles are tight is if it hurts to Kegel. If it hurts to Kegel, Kegels are not for you.
Okay. Okay. Good to know. Yeah.
Yeah. And then the other thing that, you know, it's nice to just go through is that sensation of lifting and releasing, lifting and releasing. And we want to make sure that in addition to the lift, we have that squeeze. So there's kind of that tightening and then that lifting sensation. And then the reverse happens on the way down where the muscles descend and kind of open and relax. And one thing that is helpful is to work on some of your kind of deep belly breathing as well. So, you know, if you've ever taken a yoga class or you've done some of that diaphragmatic breathing, sometimes when you breathe like that, it helps the pelvic floor relax even more because the pelvic floor responds to your diaphragm. So that can be a way to sense, okay, I feel like I didn't quite let the muscles go. I'm going to take a big belly breath. And if I feel a little bit more release, that's a sign that I have trouble releasing.
Okay.
And it's kind of tough to feel. The other thing I always recommend is, you know, if we're doing an online appointment or something, I'll tell people, you know, go home and look in a mirror. Look at your vagina, look at your vulva, watch the contraction happen, watch the release happen, and see if you notice some movement. It's pretty easy to see once you're actually visualizing that area. So if you're comfortable looking, it can be a really helpful way to know if you're doing it right.
Okay.
Yeah. So the thing that I would recommend in addition to that is I think a lot of times with the Kegels is that people will kind of just do some quick squeezes, right? So they're squeeze and release, and that's kind of their Kegel program. And some of the research tells us that for endurance of the muscles while you're running or while you're coughing and sneezing or while you're lifting your kids, you do need to have some endurance of the muscle to last longer than just that 1 second hold. Okay. So a good starting place would be, okay, let's try squeezing for 10 seconds. Oh. So we're going to tighten our pelvic floor. We're going to squeeze for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And if you felt like you could hold that whole time, great, you've got pretty good endurance. If you felt like the muscle petered out after a few seconds, it might be something to work on. So typically what I'm aiming for is to hold for 10, relax for 10, hold for 10, relax for 10, and do that 10 times. And that's a nice kind of base level to aim for if you're worried about things like leaking or prolapse. Okay. And just really emphasizing that in between, you're letting it go all the way. Okay. Yeah.
Very cool. No, that's like, yeah, I think I never even thought about that. It's always like, oh, you just do them. How many? I never thought about like, you hold it. Yeah.
And I think the advice that a lot of people hear just kind of out in the world is either you should just be Kegeling all the time or you should just do Kegels. And
while you're driving.
What does that mean? How many do I do? How often do I do them?
Because then I even heard it. I think, there is always more to it. Because I think there was even a time where I heard like, oh, well, Kegels aren't helpful at all. Like you shouldn't be doing them at all. But like, this is different than anything I've ever heard about doing Kegels. So like more thorough, I guess I should say, of an explanation of how to do them and everything. So
yeah, and the pelvic floor should, in women who have a really healthy pelvic floor, you don't need to be doing Kegels all the time because your muscles are kind of doing what they need to be doing to support you throughout your day, and they're doing it automatically. But the trouble comes in after pregnancy and postpartum, where the muscles might be weak and they're causing issues, and that's where we need to kind of bump them up a little bit and give them some more squeezing power so they can actually do their job.
Yeah. And so we know they're healthy if we aren't leaking and we don't have tightness or pain or anything like that.
Yeah.
And are Kegels like something you should do, like even if like things are good, like as like, a regular exercise routine, or is it?
I think that I would recommend making sure that you have good control over the muscles first and foremost. That's my number one, is if you can hold the muscle and feel a really nice tightening and a lifting, you can release it and feel that full release. And you feel like you can do both of those things very easily. And you're not having leaking, you're not having prolapse, you're not having pain. In that case, to me, I don't think that you necessarily need to do Kegels all the time as part of your regular program. That being said, it's not a bad thing to check in with yourself once in a while and just make sure you still know how to do them.
And that you can hold for like the 10 seconds or whatever.
Yeah, exactly.
Okay, so here I have a question. Like, if somebody were going to see a pelvic floor therapist, like what could they expect? I mean, I realize it's different depending on different issues, but what could they expect going in? Because you had like recommended like, oh, get out a mirror and stuff like that. Is that what there's going to happen if they go see one?
Yeah, so every pelvic floor therapist can be a little bit different. Typically, when people come in to see me, I am trained to do internal examinations. So people can expect, if they want one, to come in and have an internal exam done. And what that internal exam entails is a single glove lubricated finger that I insert inside the vagina or rectum, depending on if they're having any colorectal issues. And I can feel the quality of the muscle squeeze. I can feel it relax. I can feel if there's any trigger points or tender points in the muscles. And then a lot of times we're assessing that on the first day. We're looking at any other issues that they have, scar tissue and all that stuff. And then after that first visit, once I get a sense of, okay, I know what the issue is, I know whether we're on the tight side or the weak side, then we start doing more kind of exercisey stuff. I'm a big believer in that Kegels are not the only thing that works the pelvic floor. I mean, a lot of
Okay.
times my patients and I are doing lunges and squats and lifting weights, and we're
Mm-hmm.
doing a lot of exercise that helps incorporate the pelvic floor, because I know
Mm.
that there's just so many active, fit women in this area, and I wouldn't want them to expect that they're just going to be laying there and like, having this internal exam the entire time.
Yeah.
That's just one little piece of the puzzle.
Yeah.
So that's what we use for assessment. And then we go on and do more things later in treatment.
Mm-hmm.
And the other thing that I always tell people is that the internal exam is not required.
Okay.
So I'm really big on informed consent.
Mm-hmm.
If people have any history of pain with these kind of exams, or if they have any trauma in their past,
Mm-hmm.
or any reason
Yeah.
why they wouldn't want to do that,
Sure.
that's fine.
Yeah.
There's plenty of ways for me to assess. Either, I'm just looking at their pelvic floor with them undressed, or I'm just feeling over their clothes, or I'm just literally talking to them and asking them what they feel.
Mm-hmm.
I get the most information from the internal exam, but I
Sure.
can treat with any of those things depending on
Mm-hmm.
people's comfort level.
Right. Yeah, that's good to know. That's good to know, because I know it does. Different people have different experiences that can make that a little bit uncomfortable for sure.
Yeah, definitely.
Yeah.
Definitely.
Well, like, is there anything else that you feel would be helpful, or you would like us to know? Or like, I feel like this has been like super thorough and super helpful, and I imagine I'm excited to hear. I keep looking to see if anyone has any questions, but no questions that I can see yet. But just like, yeah, yours is the most thorough I've ever had anyone explain to me about this stuff. So thank you for taking the time.
Sure. Yeah, I'm happy to. I think the other things that I get so many questions about is just more of along the lines of what's safe. There's so much fear out there, right? There's so much of these things online of, oh, well, if you have, this type of problem, you can't do X, Y, and Z, and you can't do this, and you can't do that. And then people are left wondering, well, what can I do? And I think it's helpful to talk about a few principles of getting back into exercise and getting back into higher level things after having a baby. And my big takeaways from that is to start building up your core sooner rather than later after delivery. And that doesn't mean that you have a baby and the next day you're doing crunches. That means that you're doing really gentle, okay, I'm just drawing in my abs, or I'm just, gently drawing in my pelvic floor and doing Kegels after delivery. And you start to slowly build yourself up with the really gentle exercises. And then by, that 3-month mark or so, you can start getting into more stuff. The big things that I have women watch out for are all of the pelvic floor symptoms that I mentioned. So if they feel like they're getting leaking, or they feel like there's pressure or heaviness, or the feeling of bulging at the pelvic floor, if they just feel like something's really off, or they're having pain, or if they notice that they can't do something without it being excessively difficult and they're having to strain and hold their breath, those are all the things I tell people to watch out for.
Okay.
But I think it's reasonable for women to do more in general than they think they can do. And I think that there's not as much reason to be afraid. And that can be a great thing about coming in and working with a therapist, is just, getting that personalized plan and really knowing what you can do and encouraging you to move and do it in a way that you feel confident and not fearful about. So yeah, those are things that I watch out for with exercise. In general, I'm a big proponent of build yourself up gradually and slowly so that you can be as fit as possible later.
Yeah. And I know one of the things too, it's like women are hesitant, like if they have diastasis recti, did I say that right?
Yep.
Yeah. Like how do they know for sure if they have it, and like what steps to take to make sure that gets taken care of?
Yeah. So the diastasis, or sometimes people pronounce it diastasis, I think it's tomato, but you'll hear it both ways. But the diastasis recti is a condition where the muscles in the front of the abs will stretch apart during pregnancy. And then after delivery, those muscles should kind of come back together and tighten back up. And sometimes they don't do that as well as they need to. And typically what I do to assess for that, and that's a condition I work with all the time. That's a really common reason for people to come in and see me.
Right. Okay.
But typically what I'm doing is I'm kind of having them do some different abdominal tasks. So sit-ups or crunches, and I'm feeling the quality of their tissue in the abdomen.
Okay.
Typically what I'm feeling is if I put my fingers in the belly button and I have them do a crunch, there's kind of like this area where I can just sink my fingers in. It's not very firm. It's just kind of not supportive, right?
Okay.
It feels like I could just keep on going. And with that condition, what we use as the cutoff for a diastasis is typically about 2 centimeters or about 2 fingers wide.
Okay.
If the gap in the muscles is wider than that, then that's what we consider to be kind of a clinical diastasis recti. Now, that's not the only part of the story, though. I think people hear, oh my gosh, I have a diastasis and my abs are broken or they're ripped or they're torn. And I always want to emphasize, this is not a tear in the muscle. It's just that the muscle's kind of thinned and stretched out, almost kind of like taffy. And we just need to strengthen it to help the connective tissue kind of firm back up and stretch back together. It's kind of like the elasticity of the fibers just isn't there, but the best way to get the elasticity back is by strengthening. So we do a lot of core strengthening, and the big thing that I have people watch out for is things that will make the diastasis more severe, which are a lot of bearing down or breath holding or doing things that are too hard. We got to find that sweet spot between challenging you enough so that you get stronger and not challenging you so much that you're just pulling that separation apart even more. And that's I think typically that's one that also people will be very fearful about. I get so many questions about it, and it's not a painful condition. People typically don't have pain when they have it. It's just more of the sensation of you feel weak, you feel like you can't quite do the exercises you used to do, or lifting things feels a little off, or you just notice this separation when you're looking kind of from a cosmetic perspective, and that's typically the signs of it. And there is an association between diastasis and prolapse later in life. So it is important to get it worked on and get your core back in order, so to speak. But it shouldn't be anything that's severely painful. And there's a lot that exercise can do to help with that.
And so can you speak a little bit then about prolapse? Because I know like some women experience that after delivering a baby, but then I also know it's like it can come later on in life. And what is it exactly, I guess, would be a good question, because I don't think everyone knows. And then what do you do about it? Or, you know, what are the early signs, I guess?
Yeah. Prolapse is one that I tell my patients all the time, like, stay off of Google with this one, because all it's going to do is stress you out. And pelvic organ prolapse is a condition where your organs sit lower than they should, right? The official definition is kind of a descent of the anterior or posterior vaginal walls, kind of the front or the back of the vagina, kind of herniates downwards or bulges downwards into the vaginal canal, or the uterus starts to kind of descend down. And essentially, this happens for a variety of different reasons. Sometimes it can be that you pushed for a really, really long time in your delivery, or you had a big baby. Sometimes it can be, you know, if you had a lot of pregnancies, that can be something that puts more pressure on that uterus or the vaginal wall. A lot of times things that cause a lot of pressure in the abdomen and a lot of pushing downwards. So people who have to strain on the toilet a lot tend to get more prolapses. People who are straining because they're coughing a lot, or just straining when they're lifting heavy weights or things like that. So those are all things that can kind of lead to it. And there also is a genetic component to this problem. But the prolapse is another condition that it's not painful. It's just uncomfortable. And basically what people will notice is that they feel like something is falling out of the vagina. That's kind of the best way to describe it. It's like kind of like the sensation of a tampon falling out. And they sometimes will look in a mirror, they can see some tissue kind of bulging out of the vagina, or they can feel like there's just pressure or heaviness. And the thing that's unfortunate about this is that it can progress. So in the really, really severe cases, the organs can actually come outside of the body. And those are cases where people typically will need to get surgery. But I like to tell women that there are different grades of prolapse. So when you do the Google search, you're going to see the really severe, like awful, you know, ones where people have to get surgery. And it may just be that you have a really minor one that your gynecologist let you know about, and it's not time to freak out yet.
Right.
But I think it's a really nerve-wracking and vulnerable thing to feel like your organs are falling out, right?
Sure.
So I can understand why people feel so worried about it, but I always like to say there are shades of gray along the spectrum. It's not like you go from nothing to your organs falling out overnight. But the research tells us that getting your pelvic floor to support the organs better and help to lift them up, doing that earlier can actually reverse some of the prolapse changes and completely eliminate symptoms. So the earlier you come in, the better things are going to be. And if you start noticing some of that, that's definitely a reason to talk to your gynecologist and maybe get a referral to pelvic floor PT.
Yeah. No, that's so good. I'm just thinking like, if we like just another thing that if we take care of ourselves sooner, like symptoms can be less, so just another, just with everything, like I think we tend to not put ourselves last on the list of things to take care of. And so I think just another reason, like take care of yourself, do the things that you need to do to get the support that you need, and that you can, relieve symptoms and stuff like that, and maybe reverse anything later on in life. So that's super helpful.
And I think my two big things that you can do now to avoid prolapse in the future is, first of all, just noticing your pelvic floor. It's helpful to, like I say, do your own little checkups in the mirror. Then you'll catch things earlier. If you start to feel like, oh, I feel a bulge, and you see that you notice some bulging that wasn't there before, you're catching it earlier, right? It's kind of like doing a breast self-exam, right? You're catching these things early. So that's my first tip. And then my second tip would be avoid straining. It's so common that new moms strain so much. And part of it's because their core is not working too well, and they've got so many more things to lift all the time. I mean, there's just so much lifting that goes on with babies.
Yes.
And so instead of using their muscles, they're doing this every time they're lifting a load of laundry, or every time they're putting the car seat in the car, every time they're doing a crunch. They're straining and they're bearing down and they're putting pressure down. So my big thing is breathe. I think about, if you're going to do something hard, blow out while you're you're lifting the car seat, and you as you lift it. And that's one of the easiest things you can do to prevent this from getting worse.
I love that. Just another reason to make sure you're getting your deep breaths in every day.
Definitely breathe.
At all times. Breathe. Take them in. Yeah. Blow them out. Yeah. Awesome. I think this has been super helpful for me. I'm hoping that everybody else feels the same way, and I'll be sure to pass them along if they have other questions to you. And I know you're part of the group, so if you guys have any questions, maybe you'd be willing to answer any that pop up.
Absolutely. I'm completely happy to answer any questions that people have. And I just wanted to say as well, so I am located in Davis at Physical Edge PT. And if you have any questions for me about whether pelvic floor PT might be right for you, or you're not quite sure what to expect, I do a free 15-minute phone call consultation. So you can always call our office and get one of those scheduled with me. And we can kind of figure out if this might be a good thing for us to pursue together.
Yeah, no, that sounds perfect. I love being able to answer any questions somebody might have. So that's great that you do that. So awesome. Well, thank you so much for your time today on this beautiful Friday afternoon. And and maybe down the road too, like if you guys have any questions of anything else, maybe we could always do this another time. So
we could do a part 2 anytime you want.
Sounds good. Well, thank you so much for being here with us. And I hope you have a good rest of your day. And I hope all of you out there in the world have a beautiful rest of your day as well, and have a lovely weekend. So thank you.